Good evening, and welcome to the members of the media who have joined us today. I am joined at our weekly press conference by the Minister of Health, the Honorable Kim Wilson, who will be providing an update to the public on the latest from her ministry, including the latest test results and proposed changes to travel requirements. Following that, I will give an update on matters related to education, steps we must all take to curtail the spread of the coronavirus, and an update on the We Health app pilot. First, we'll go to the Minister of Health. Minister?
Thank you. Good afternoon, everyone. I would like to begin today by recognizing World AIDS Day, which is marked annually on the 1st of December. World AIDS Day is an opportunity for us all to show support for people living with HIV/AIDS, to remember those who have died from the AIDS-related illnesses, and to thank those organizations who have provided critical support services for those persons living with HIV/AIDS and their families. It is also a chance to reflect on how far we have come and to focus on raising awareness and understanding of the disease and the importance of knowing one's status. HIV has not gone away, and the Department of Health continues to provide public education so that younger generations have an increased awareness of the risk and are sensitive to the needs of those persons living with or who are affected by HIV. As of the 30th of November, 2020, it is estimated that there are 301 persons living with HIV infections in Bermuda. I would like to acknowledge our communicable diseases control team, public health nurses, and the nurse epidemiologists who provide care and health counseling for persons living with HIV/AIDS. And I personally value the work that they do tremendously, and it brings me great pride to be a part of that dedicated and accomplished team. Let's continue to work together, Bermuda, towards an HIV-free Bermuda. Now I'd like to share some of the latest COVID-19 results. There were 1,060 test results received by the Ministry of Health yesterday, the 30th of November, and 2 were positive for COVID-19. One of the new cases is classified as imported with details as follows. One resident who arrived on a private jet from the United States on the 21st of November, 2020, and tested positive on their day 8 test, having had a negative pre-test and arrival test. The other new case is classified as local transmission with known contact, and their details are as follows. It was one resident who was under quarantine as a close contact, namely a workplace of a known case. Bermuda now has 262 total confirmed positive cases, and their status is as follows. There are 39 active cases, of which 38 are under public health monitoring, and 1 is hospitalized, and none are in critical care. A total of 214 have recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 51 years, and the age range of all of our positive cases is from 0 to 101 years. To protect privacy and confidentiality, the age of the hospitalized case will not be provided. The average age of all deceased cases is 74, and the age range is 57 to 91 years. The source of all cases is as follows. 122 are imported, 112 are local transmission with known contact or source, 21 are local transmission with an unknown contact or source, and 7 are under investigation. The 7-day average of our real-time reproductive number is greater than 1, namely it's 1.27, and Bermuda's current country status remains a cluster of cases. It is important to note that as investigations proceed, transmission categories may change. Also, to clarify something that I was asked yesterday about at the press conference concerning the state of investigations, and I indicated that it was 14 days before an investigation then turns to unknown. It's actually 28 days. So I apologize for that information being incorrectly provided to you yesterday. So at the end of 28 days after the investigation, then the local transmission, it will be changed to local transmission with an unknown contact. And now a few updates. We have amended our health regulations so that it is now an offense to not wear a mask in accordance with the guidelines. A person who fails to wear a mask when one is required, commits an offense and is liable on summary conviction to a fine of $500 in respect of the first offense and a fine of $1,000 for any second or subsequent offenses. Also, I can advise that as of today, the 1st of December, the COVID-19 call center will be extending their hours and will be open from 8 a.m. until 10 p.m. Previously it was 9 a.m. to 9 p.m. And this is to accommodate any travelers encountering travel authorization issues before their late flight or their early morning flights. I would like to issue a reminder also to travelers or potential travelers that as of Friday, December 4th, a pre-arrival test must be taken 5 days before arriving in Bermuda, not 7, as was previously the case. This will reduce the time period in which a traveler could have a potential exposure before boarding their flight to Bermuda. This means that for travelers arriving in Bermuda on the 9th of December, their test cannot be dated any earlier than the 4th of December. As we enter the festive holiday period, the Ministry of Health is reminding all travelers, including our returning students, that they are subject to mobile quarantine restrictions on their movements and activities until they receive a negative day 14 COVID test results. Therefore, all travelers should do the following: wear a mask at all times when in the company of others, avoid mixing with cramped, poorly ventilated indoor spaces with non-travelers, and not attend large family gatherings. And in particular, returning students should be careful of mixing with local students and family members while on island prior to their negative day 14 COVID-19 test results. Similarly, those traveling for business should take the necessary precautions when returning and interacting with family and friends. Also, while on the topic of businesses, I would like to ask that businesses hoping to hold celebratory Christmas lunches, please keep their teams separate and your festive gatherings small and limited to your work or your team bubbles only. This is not the time to be holding big client lunches with those outside of your office. This will help to ensure that industry you work in, the risk of spreading infections in the workplace is ever present. It is important that everyone knows the risk, how to stay safe, and keep themselves and everyone around them healthy. This is why I'm encouraging all employees and management to complete the Ministry of Health's Infectious Control and Prevention online training, which covers the fundamentals of infection prevention and control of COVID-19 and similar type diseases. And it can be found at the government website, www.gov.bm/infection prevention and control training. In terms of general advice, which the Ministry of Health is issuing to residents at this time, please note the following tips. Ensure your workplace is following COVID-19 protocols. Reduce your bubble sizes. Choose only 1 or 2 other households to socialize with over the next few weeks. When you meet others, meet outdoors and wear masks and observe physical distancing. If the weather is good, ask your church to host outdoor services or to broadcast services online so that you can still participate. Wear your mask properly. Wear your mask properly. Wearing a mask with your nose exposed or covering your chin is not wearing a mask at all. Consider postponing events until it's safer, and avoid indoor spaces, crowded places, and close contact. Please, everyone, just hang in there. We are so close to getting to the vaccine. Please, please do not let things get out of control at this point in time in the game. Yes, the holidays will look different this year, but we have to constantly consider what is at risk if we do not buckle down for the next little while. If people ignore public health measures, we will see more and more cases and head down the path to community transmission. I would like to remind members of the public to use the Bermuda self-reporting website, which is healthiq.bm. HealthIQ helps us as a community to track symptoms based on COVID criteria. It also provides users with individualized information and follow-up by professionals based on various risk factors such as being medically vulnerable, and it tracks trends and gaps so that we can better identify places where partners like donors and the third sector can focus their resources. Health IQ provides the island with more insight where potential cases of COVID-19 may be and gives us proactive ways to address them, giving us tens of thousands of eyes so that we can all stay safe. We are asking that each household go to healthiq.bm and enter your information and update it often. It only takes a few moments and it is completely private. Give yourself and your community a better understanding of how we are all doing. Before I close, I would like to state that I am aware of a petition currently circulating which asks for an extension to the quarantine time for passengers arriving to Bermuda to 8 days. First of all, I want to say that I am extremely sympathetic to the plight of the parents of children who have had to keep their children home from school and quarantine them in response to the latest cases. However, I can confirm that government is not looking to quarantine travelers until day 8. This would be hugely detrimental to our already struggling tourism sector. Who would come to Bermuda if they knew that they had to quarantine for 8 days? We must balance the need to protect public health with the need to keep our economy going. However, I can say that we will be tightening up certain aspects of traveler protocols and details of which I will be sharing in my ministerial statement this week, Friday. In closing, I would like to appeal to members of the public. Please not circulate private details about positive cases. I know sometimes this is motivated by a desire to help or a desire to be best informed, but please let the contact tracers at the Ministry of Health do their jobs. If you need to quarantine, they will let you know. If you need to stay home from work, they will let you know. Public health is our number one concern, and I urge you to please follow their advice and instructions. Another balance which we must strike is the balance between a person's right to privacy and the press's need to report and inform. We must protect people's privacy, just as we do with other communicable diseases such as HIV. Privacy is something we value beyond measure at the Ministry of Health, which is why I do not always answer every detail of every case when I appear at these press conferences each week. Some details would identify an individual, and we will never compromise public trust or individual confidentiality. I appreciate and understand the need for transparency and relevant information to be provided to members of the public, and I must emphasize the word relevant. However, this must and will be measured first and foremost against the backdrop of a person's right to privacy. I will not compromise this for the sake of the press's insatiable desire to receive personal details, private details of an individual, details which could serve to identify that individual. And I thank members of the press in advance for your understanding of my position. When positive cases are flagged to the Ministry of Health, they are given a number, and that is how they are known during the internal case discussions. Next week, I will provide further information on testing opportunities for residents, which are currently being finalized with respect to different locations throughout the island, as well as testing hours, and more details will follow. Thank you.
Thank you, Minister Wilson, for your updates. And I also want to again thank you and to commend your team for your work over the past week as we have dealt with this outbreak. The Ministry of Health team, led by the Minister of Health, worked countless hours over the weekend, late into the night, and they have been going at this for 9 or 10 months. They deserve all of our gratitude, and the best thing in which we can do to them is to continue the work which we must all do, which is to observe the guidance. There is no need to sugarcoat where we are. Having gone weeks without a single confirmed case and then experiencing sporadic cases, we now have clusters of cases and 7 cases that are still under investigation. This means that people have caught the virus, although they nor anyone in their immediate circle has any immediate links to travel. They were exposed to someone who was infected here on island, and we have not been able to determine the source as yet. Good news is through the work that is being done by the team at the Ministry of Health, there are less cases under investigation today than there were yesterday. Since and all of the restrictions that were imposed were put in place based on guidance from the Ministry of Health and best practices from other jurisdictions who are managing the pandemic well, with one goal in mind: to ensure that our healthcare system was not overwhelmed and to ensure that we did not see a large number of deaths on our shores. Over the past few weeks, there has been a great deal of attention placed on our schools. Decisions about the schools were not taken lightly. The Ministry of Education works closely with and follows the guidance of the Department of Health. Each school, each case, each circumstance is different. This government will always keep the health and safety of our students, teachers, and staff a priority. Going forward, to reduce anxiety and stress, if there is a confirmed positive case within a public school, I have recommended to the Minister of Education that in-person learning at that school be suspended. It is important to note that this means a confirmed positive in the school, not a close contact or not a student, staff, or teacher who may be a close contact, which would only require selective quarantine, as we saw in the case of West End, Paget, and St. George's Prep. The Minister of Education has indicated that tomorrow morning he'll be convening the inaugural Education Emergency Measures Committee to confirm the new policy, which will bring clarity. While in-person classes are suspended, the following will take place. Students and teachers, if necessary, will be tested. The school will be deep cleaned, and the Department of Health will advise when the school is ready for reopening for in-person classes following their assessment. Health and Education will continue to work closely to ensure they provide timely, accurate information to the principals, teachers, staff, parents, and students. Likewise, I encourage all students and staff with the support of parents to follow the Bermuda Public School safety and health protocols. This government's goal is to continue to strike the right balance so that we can continue to enjoy our ability to earn and our children have the ability to learn while keeping our country safe. Many have contacted me requesting that I immediately revert the country back into shelter in place, or asking the government to close the airport to scheduled commercial flights, or wondering when another curfew is put in place. And unfortunately, due to rumors, some persons have even started panic buying again. Let me be clear. Right now, we do not see a need to bring back shelter in place or even to revert to curfews. However, circumstances can change quickly. This government made a choice to have some form of a tourism season in order to ensure that thousands were able to return back to work. Yes, there are some who feel that we should not have done this, but this was the decision that we took for the collective of the country. Now is the time that we all support our fellow Bermudians in the hospitality and tourism sectors, persons who are not salary, who rely on hourly wages and cannot work remotely. We must support them all by doing our part. How we move forward will depend on the actions each of us take over the next 2 weeks. Between now and the middle of December will be critical in determining if we are able to continue to move around freely or go backwards and introduce further restrictions on activities. I know that no one wants to go backwards, especially over our Christmas holidays. Our students are returning from overseas, where in many places record infections of the coronavirus are being experienced. It is important that all persons are disciplined and practice increased vigilance to ensure they are not a source of infections for their family or friends. We are aware that some people are returning from overseas travel and not sticking to the quarantine requirements. As the Minister of Health alluded to, the Cabinet considered new measures today to deal with these challenges, and they will be announced by the Minister of Health in the House of Assembly on Friday morning via a ministerial statement. The Minister will consult with our parliamentary colleagues, business and tourism groups prior to the announcement of these further actions. Given the unfortunate nature of the situation overseas, it is likely that these may include further restrictions of persons who arrive in Bermuda from overseas. Our testing regime worked well when the situation overseas was more managed, where we were not seeing record infections, and in some cases, positivity rates exceeding 50%. But the recent spikes mean that we must take more actions to protect our country. It is important that we all continue to adhere to public health guidance that is designed to keep us safe. I have received calls and messages to my office detailing people at venues and social events not wearing masks. As a reminder, if you see activities taking place that are in violation of the laws that are in place to keep us all safe, please call 211 and advise Bermuda Police Service, who will take appropriate measures. If the activity takes place within a local establishment, you are encouraged first to address the issue directly with the appropriate manager. Some residents have expressed frustration that the 211 number has rung busy when they've called. As of tomorrow, the Bermuda Police Service will add additional resources to manage the volume of calls and to support us all doing our part to make sure that we remain safe. As I have said repeatedly, and as the Minister of Health has said repeatedly, this is not the time to relax. Unfortunately, many of the infections that we've seen over the last few weeks can be due to persons not following the rules and not following the guidance, especially workplace guidance. Quite simply, they were avoidable. These protocols will prevent the spread of the coronavirus and can save lives. And as I stated last week, the virus only survives if we let it survive. If we follow the simple measures to mitigate virus spread, Bermuda will be okay. There are people who have the coronavirus this week, who did not have it last week. This is a worrying, stressful, and frightening time for them and for their family members. We must hold them in our thoughts and prayers as they move towards recovery. Many in our community, including our leaders, are feeling the stress of living in a pandemic era. We are reminded daily to wear masks, to wash our hands, ensure that we stand 6 feet away from others. I have heard from many people who've expressed their frustration and are just tired of this. As the Minister of Health said, we do not have that much longer, as there is help that is on the way. But we must continue to do what we have been doing better and to continue it to ensure that we can reduce this current outbreak. We all remember what life was like last year this time. Many recall what we did to prepare for Christmas. Like every holiday and every celebration this year, Christmas will be different. Some families are considering eating outdoors. Those who would have traveled are investigating virtual gatherings. And yes, we all have to be creative. We must do everything we can to ensure that we do not contract the virus or create opportunities where it is spread in social and/or other settings. To prevent the spread of the virus, we must do the following. Unless it is absolutely necessary, please do not travel over the Christmas and New Year holiday. If you must travel, take extra precautions while abroad. If you have returned from travel, and even if you have had negative tests, we ask that you are careful. And that means to ensure that you do not attend large gatherings, do not use a gym, and be sure to protect babies and seniors and persons with chronic conditions. Do not go near to those persons who may be vulnerable. The key point to remember in all of this that we are experiencing is that the decisions that are made by the government are based on comprehensive, scientific, and data-driven evidence. In turn, you should only make decisions that have been communicated through official government channels by a government official or a public health official. As the Minister of Health has said, it is not helpful if you are communicating methods directly or persons' information directly to others. The Department of Health has a team that is an expert in doing this, that is expert in managing, that is expert in managing our privacy and making sure that people's privacy is protected. Those of you who create and share voice notes and messages that create panic and increase anxiety are not helping. So please, if it's not official, I ask you not to forward it. That much being said, the government can and must do a better job with timely communication. And in some instances over the last week, the communication has been slower than it needs to be. I apologize for this, certainly, and the anxiety that this may cause, and I certainly pledge to work to do better. I am grateful, however, to our dedicated and hard-working communications team here at the Department of Communications that has worked day and night, weekends and late nights to ensure that we can keep the public updated. I want to thank them for their dedicated work and their dedicated efforts. Moving to the WeHealth app. Since we announced the WeHealth Bermuda pilot during last week's press conference, over 2,000 persons have downloaded the app. WeHealth Bermuda is a free smartphone application that provides completely anonymous COVID-19 exposure notifications. The Bermuda pilot is going well and as planned. If you haven't already downloaded the app, visit the Apple App Store or Google Play and download it today. Just type in WeHealth Bermuda. Excuse me. Visit gov.bm/WeHealthPilot for more information. The Department of Health, in collaboration with IDT Digital Services and WeHealth, are continuing to thoroughly test the app. Recently, simulations designed to recreate real-life dining scenarios were conducted at a local restaurant, and these tests went as expected. Those who have downloaded the app may see a message that says, "This region is not currently fully supported by the app." That message is intentional, as the pilot region is being utilized for continued tests. Once we fully exit the pilot and launch the app for the Bermuda-wide rollout, that message will be changed. Thank you to everyone who has provided feedback on their WeHealth Bermuda experience so far. If you would like to provide additional feedback, send an email to covidapps@gov.bm. Although we are still in the final stages of testing the app, we welcome all Bermudians and visitors to download the app ahead of the full launch from Apple's App Store or Google Play. Once you download, there is nothing else to do. No registration, no need to enter your phone number, email address, etc. As I said, it is completely anonymous. Encourage your friends, family, and coworkers to download the app ahead of the full launch too. As a reminder, WeHealth Bermuda will run on iPhone models 6S and above, and also Android users can use the app if their phone supports Bluetooth Low Energy and Android version 6 or above. And as a reminder, the application is completely anonymous. I will close, as I always do, with a reminder for those who are experiencing anxiety, stress, depression, or other challenges. There is help available, and you can get help, and you do not have to suffer in silence. Please, if you need to speak to someone, contact the Emotional Wellbeing Hotline. The phone number is 543-1111. I'll repeat that again. It's 543-1111. It is important that we pay attention to our brain health as well as our physical health. And I want to thank the persons who continue to monitor the Emotional Wellbeing Hotline for the work of which they're doing for our community. That concludes my remarks this evening, and I'm happy to take any questions from members of the media.
Good evening, Trevor Lindsay, TNN News. Minister of Health, if you can clarify, legislation was put into place for mask and social distancing against the law for, can you explain exactly what is the consequences of this new law?
Thank you, Trevor. We amended the Public Health COVID-19 Emergency Powers No. 3 regulations recently, and part of that addresses the requirement of mask wearing it would have had previously certain other types of regulations. One was to maintain physical distancing, and now there's an amendment in the legislation that provides effectively that a person is required to wear a face mask as required by these regulations, as well as maintain the appropriate physical distance. And failure to do so commits an offense under the summary offenses, which is magistrate's court. The first offense is a fine in the sum of $500, and any second or subsequent offense is a fine of $1,000.
These masks.
Let me just add to that. These were always part of the law. The new addition are the fines, but the law had always required persons to maintain their physical distancing and to wear masks. So that has not changed. There are now fines that are attached to it.
My question, I guess, is these masks must be wearing in public places. Where to exactly?
In public places,
In
correct?
Okay.
Yeah.
The law is very clear
Yes, sir.
in regards to the circumstances of where they are necessary and required. And in instances where you are unable to keep physical distance, that is, when you are not with members of your own household, that is what is required.
Thank you. Minister, I'm not so sure if this question was asked yesterday, but shoppers at Shelley Bay Marketplace over the weekend, those that were not involved in the testing, had some inquiries reference to many people in the parking lot and causing anxiety for shoppers. Would a possibility of maybe Shelley Bay Field or the parking lot by the basketball court be a consideration moving forward for pop-up testing in that area?
Thank you for that question, Trevor. And it allows me to say something very important, which is to thank our partners at Marketplace stores, because they have been extremely gracious over the last several months in allowing us to use their facilities with respect to providing the pop-up testing. Without them, we would have been very challenged because we did not have proper locations. However, we have secured locations that are all covered so that the issues of weather and so forth will no longer be an issue. I will be releasing more details about that probably as far as where those facilities, those locations are and the time. So we will not only expand the testing hours, but these particular pop-ups will allow times to accommodate persons that are symptomatic as well as persons that are non-symptomatic, so they can make their appointments and book online. And again, we will be sharing those details as well as those locations. There'll be a location in the center for Dawn, east as well as west. But again, I need to end where I started by thanking Marketplace stores for their cooperation throughout this particular endeavor.
Christoph, I've had this past week, I've had a few young children from middle school and high school questioning the difference between masks and shields. Complaints coming in about their school teachers that have shields on teaching classes, and these children are very much alarmed and want to challenge these teachers. A shield is one thing, but a mask is completely different, and a shield is not a mask. Your take on that?
Yeah, you're absolutely right. And we've actually spoken about that previously when we started noticing that there was a more prevalence of shields. The mask is the one that provides the vital protection because it has more of a covering with respect to preventing aerosols. If you have on just a shield and you sneeze, the aerosol can still get around. If you wear both, that's fine, but you must wear the mask.
Thank you much. Premier, workers were made redundant, were asked to pay back insurance payments made by Apple Beach and Southampton Princess during the layoffs. Has government taken steps to assist, or will government assist with these payments?
I do not believe that the government will assist in any legally mandated deductions from employees' pay packets. And the methods assist for persons who require assistance, that they can go to the Department of Financial Assistance and either apply for the supplemental unemployment benefit and to avail themselves of assistance, and that is there. So the government provides the assistance, but in regards to the specific circumstance which you mentioned, I don't think so.
Okay, my next question. On November the 17th, I myself asked you in regards to the monies paid for redundancies. You stated categorically the monies, and I'm talking about Southampton Princess. You stated, my question was, let me paraphrase. My question was,
Paraphrase it?
But let me ask you a question. Will the monies that the government paid to the workers be paid back to government? The workers pay it back. Are you guaranteed that the monies will be paid back? And you categorically stated that JAMCO will pay back the monies to the government. On Friday, the minister indicated that there was no guarantee, there was no agreement. At that time, did you know, when you asked my question, when I asked your question in the 17th of November, at that time, did you know there was no agreement in place for them to repay the government?
Your question has a lot of different things to it,
Avenues?
so I'm going to try to make it as simple as I can. As has been stated in lots of instances, and I don't know where this issue of no agreement comes from, but here is the
minister, the
understood.
finance
Trevor, let me
minister.
finish answering the question, please.
Yes,
I'm
sir.
gonna help you out here. And I'm happy for you to give me the ability to explain to everyone, as the minister tried to explain to the country yesterday,
Mhm.
and I'm happy to give further clarification or continued clarification. The obligation of redundancy is an act under law. As the minister had indicated, that persons who were lent money from the government had to assign their claim of that to the government of Bermuda and a pledge to make sure they went ahead and repay that money. What I'm saying is that that claim in and of itself is a legal obligation. There is no separate contract that is necessary or required to confirm the legal obligation that exists. It is under the laws of Bermuda, underneath the Employment Act. So there is no separate legal obligation. Any individual who received a loan from the government was required to sign up to that agreement.
Thank you. Trying to find my next question. Here we go. Is there any update on the $12 million loan investigation, as you quote? Is there an update on that? The $12 million one is that were loaned to the, I can't even get the guy's name. $12 million issue. What was it?
I have no recollection of $12 million.
No, I'm saying, I'm not 12 million. I'm sorry. $11 million. Was it eight? Let me withdraw that question. The $800,000. I'm sorry. I wrote it down wrong. 800. My bad. The $800,000 that was loaned to the businessman in New York to set up a business here. Has there been any update on that?
I don't have any updates regarding the police investigation, but I'm happy to ask the governor when I meet with him tomorrow.
Thank you. My last question. That was the last? Thank you much. And forgive me again.
No problem. You're okay, Trevor. We're good, you know.
Good afternoon. Owen Johnson Barnes, Rural Gazette. Obviously, with the holiday season coming up, you have a lot more people who are going to be shopping, a lot more people who are going to be traveling, both coming to the island and likely leaving the island as well to do their holiday shopping, unfortunately,
I would
for our
sincerely
local
hope
businesses.
not, Owen.
But it's still probably likely going to happen. Is there a concern that because of the holiday, we are going to see a continued rise in cases?
The concern always exists. We have noticed because, of course, our gateway cities are located, particularly in the United States, has had a surge, and they're having a second surge because of the holiday travel and the like. So clearly, as long as people continue to come to Bermuda from the United States, then we are likely to see our infection rates rise. However, having said that, we still have, as you've heard us speak about, the aggressive testing regime, and we have surveillance. And now we're narrowing that surveillance by requiring persons to have a pre-test 5 days out as opposed to 7 days out. So we're certain that will help to narrow the transmission rates that we've been seeing on our day 4 test. As I've said previously, we are strongly discouraging any resident from traveling overseas unless it is essential. Perhaps they're picking up their children, or alternatively it's for medical reasons. But I would like to implore any individual not to go to the United States for the sole purposes of shopping. Not only do they risk the infection, you see in some places in America, it's like every one person that's infected, 2 people are affected thereafter. I mean, it's ridiculous. So to go get shopping, to go and stand in that particular madness, I think is a little bit insane. But in particular, you have to return home. And we can see how quickly COVID has spread in other communities and the devastating effects. And I know nobody would like to be responsible for knowing that they went overseas on a frolic of their own, returned home, and were the index case for a cause of transmission to their family members. I'd like to believe that Bermudians are a more caring bunch and that they wouldn't necessarily risk putting their family members themselves as well as the country and their neighbors in risk. So we would certainly dissuade anybody from going shopping for the purposes of doing their Christmas shopping and traveling unless it was essential.
Now, earlier on in your presentation, you mentioned the recent petition received by government.
Mm-hmm.
Obviously, the reason why you have said that you're hesitant to put in more restrictions on the quarantine period was to try and protect the tourism industry.
Mm-hmm.
This might be more towards the premier, but what are the tourism figures like right now? How many people are actually coming into the island? How big is that portion of the economy that we are saving?
I don't know, but I'm happy to get that update for you next week.
All right,
I haven't had that update for the month of November. I do know that the month of October was certainly a good performing month. We did have a BTA board meeting on Monday. Those figures were there. November was certainly down on October's performance, which is not unexpected. And we've seen one or two properties close. But the fact is that there are still a number of properties that are open. And the number of properties that are open are keeping Bermudians employed in a number of aspects and supporting the economy. Certainly, as I indicated, our requirements were working well when the situation was more managed overseas. As the situation is now deteriorating overseas, we have to make different considerations. And so we're going to continue to work with that. As I said, we've had discussions. We had a robust discussion in our cabinet meeting today. We don't want to go ahead and announce changes and blindside persons. As the minister has said that she's going to confer with her parliamentary colleagues. Those would be our caucus members and also members of the opposition, certainly business groups and tourism groups, to make sure that we are clear with our communication. And she will announce that to the country on Friday in her ministerial statement. And she will enjoy the full support of the government. It's a difficult situation. It's a difficult circumstance. But we made the decision to reopen our economy to a tourism industry to make sure that we can have over 1,000 people return back to work to earn for their families and the supporting industries that are there. And so now we have to manage and deal with this. But the most important thing of which I can say is that a lot of these ongoing transmissions which existed were completely preventable. Yes, I know that it is painful, but if we do what is necessary, the virus will not overtake us. We will overtake it.
Now, you mentioned communication earlier. Obviously, in the last 2 weeks, there have been a few issues regarding the schools. We have received some complaints from parents who are concerned about the level of communication. Some say they've not been told whether they are to be quarantining at home or whether they are allowed to go to the shops, whether they're allowed to be in mobile quarantine. Sometimes they hear one thing and then one of their friends hears a different version of events. Can you say what the government is doing to improve that communication and strengthen that so that people are fully aware of what they should be doing when they are in quarantine, and when they're free to move around?
Owen, as I was explaining yesterday, each circumstance is different. There's an assessment conducted, et cetera. However, I do know that letters have been sent from the Ministry of Health to the respective principals of the schools for onward transmission to the parents. I appreciate that there's, I don't want to say confusion, but perhaps misunderstanding as to what is exactly quarantine. Does that mean I can go to the store? And of course, the answer is no, because you're supposed to be in quarantine. But insofar as the communications, like the Premier said, we could have done better, and we are striving to get the messages out a little bit quicker. The press conference that we first had a week ago Sunday, with myself and the Minister of Education was held in the evening, principally because we were still gathering information, and I didn't want to appear before the public without having all the details and the facts. And we were uncovering things very, very rapidly. And I wanted to be able to provide a fulsome explanation as to where we were at the time, but recognizing that we do need to tighten up on our communications and make it a little bit more expeditious.
What it's also important on that, Owen, is that, and as I said in my speech, I don't want to slight any of our communications officers. You have very hardworking one that's standing behind you. We have the people who bring us these press conferences, both behind the camera and behind the scenes, and the communications officers in all the departments and all the ministries who work feverishly, sometimes 10, 11 o'clock late into the night on the weekends, making sure they get out the information. Certainly, there have been gaps, but I think what's most important is that we operate off of the facts and respond back with the facts. The ministry, a lot of people want information first. I know that there's the desire to send out the information, but we follow a process where we make sure we inform parents first before we inform the public, that we inform staff first before we inform the public. And that communication which goes out, the ministers talked about more notifications. I'd encourage persons through the programs of which they're asked to have, such as Power School, to make sure they put Power School and update those on their devices and make sure their information is up to date, as there are also communication methods that are sent through there. They do contact the parents. They do send out the letters that are there. I do know that there is some ambiguity with the letters which has been expressed, and I know that even some of the letters have been from last week to this week have been made more clear. They will continue to be made clear on those aspects. But we recognize what it is that you were saying. We recognize that we can do better, and I would say that we have improved, but we want to make sure that we get it even stronger.
Now, one phone call I received last week was someone who went to Shelley Bay to get tested. They waited in line for an hour. And when they got to the front, they were told because they had symptoms, they had to come back at 5 o'clock to get tested. Is there a different policy for people who appear to get tested with symptoms versus without symptoms? And can you perhaps explain that so that people understand when to go and where to go?
Thank you. If a person is symptomatic, they may very well attend on their own or alternatively through their doctor. However, what we're encouraging them to do is to contact the COVID hotline, and they will in turn speak to one of the nurses to arrange a time for them to be tested, because what we don't want at this point is symptomatic persons just appearing in the general population. What we generally do is test symptomatic persons at the end of the day so that, again, the general population, they're not mixing, so to speak. When we announce further details concerning our next set of testing and the locations, there will be specific times. So, for example, from 9 to 1 will be for persons that have no symptoms and they made appointments. From 1 to 4 will be symptomatic persons, but all those details will be revealed. But certainly if a person has symptoms, they're instructed to contact their doctor, and the doctor will provide them with details, which include contacting the hotline so that a nurse can make arrangements, or one of the hotline team will make arrangements with respect to the time for them to take their test, which is normally at the end of the day or alternatively at the cathedral, but it's all arranged.
Now, this is probably a little too early, but obviously vaccine news is coming out fairly regularly now, and different countries are now discussing their potential approach. We understand some countries are going to have an approach where essentially they use the Moderna or Pfizer vaccine, which are more expensive and more difficult to store for the high vulnerability cases, where because they have a higher success rate, while using the cheaper Oxford vaccine for the general populace who might not be at high risk. Right. Is Bermuda government considering these sorts of strategies? What can you say so far?
We have looked at two avenues, two strategies, so to speak, to secure the vaccine. One is through the COVAX facility, which we've signed up for, and we'll be securing vaccinations through that, through PAHO. And the other is through Public Health England and the Foreign Commonwealth Office are providing a supply equivalent to the proportion to which the United Kingdom receives for the OTCs. And we will be, I don't know the percentages right now. I think for the COVAX facility, it represents 20% of the population because it's two shots. And we will be getting, I believe, all three. However, I think of equal importance, if you don't mind me just adding this, because one of them does require cold chain storage. And so we have ordered the requisite refrigeration freezers, I think they are, to be able to store that. So everything is in play. You would note that there has made applications have already been made with respect to emergency approval, et cetera. And we're just waiting for them to be supplied. The one that we will be getting through Public Health England and for the OTCs, they've indicated that rather than us getting it from the United Kingdom, once it arrives in America, we'll be able to get it from there. So it'll be a lot quicker for us to receive it. So more to come, and I will constantly provide updates to Parliament as well as to the press. But we are very excited because we anticipate that we'll be able to get them certainly by the end of December, is what has been the last bit of information we received from Public Health England. And we are in the process of finalizing our distribution mechanisms and protocols, which will be, of course, healthcare workers and our most vulnerable population first and foremost.
All right.
Sorry, that seemed like a very long answer to your question.
No problem at all. I'm happy with long answers. I actually think that's all I have right now.
Okay.
Evening, everyone.
Evening,
Maya
Ms.
Palacio
Palacio.
for Media Maya. My first question is a follow-up actually from Trevor's on the mask mandate. So Minister Wilson, who exactly will be, tasked with giving out these fines?
As I said, it's a summary offense. So just like under the Summary Offenses Act, if a person commits an offense, the police will put together a file. The file goes to the DPP's office and a prosecution ensues thereafter.
Okay, thank you.
Mhm.
My second one too is in your statement addressed to the speaker, I believe last week or Friday, you mentioned and said, Mr. Speaker, once landed travelers are subject to mobile quarantine restrictions and these are being reassessed. So can you please just explain a little bit, because I've actually had questions come to me, what exactly is mobile quarantine?
Okay. It does sound like an oxymoron because the word mobile suggests movement and then the term quarantine suggests stay still. So I appreciate that there is a misunderstanding with respect to the phrase. However, on Friday, I will be revealing a lot more. And what we're effectively saying is that there will be levels of activity that a person can engage in up until the point that they receive their day 14 negative test. So as you appreciate, unless you're a local resident, you would have to have had a pre-test, and all persons that arrive in Bermuda are restricted in their movements until they receive the results of their arrival test, assuming they have a pre-test. Then, of course, if you're a local resident, if you don't have a pre-test, then you have to quarantine for 8 days with the bracelet. But there will be incremental activities, so to speak, that one can engage in based on, I don't want to say level of risk, but based on the level of where they are within the testing regime.
Okay, thank you very much.
You're welcome. But I will be revealing more on Friday when I display it to the House of Assembly.
Awesome. Looking forward to that. Mr. Premier, tonight you said about whether or not you were talking about shelter in place, that not being quite what the government's even thinking or even on the brain right now, and it could change, or you said, depending on circumstances, things can change quickly. What circumstances would need to change for the government to even consider a second shelter in place?
Well, that would mean that we would have to certainly change with our indicators. But what I would like to direct you to, Ms. Palacio, and I actually did print it out. If you go to the website coronavirus.gov.bm, and if you go to the COVID update page, it does have this chart which shows the lag and lead measures, and it actually shows the things where it gets us, where it puts us in the red. And so when we get to the place of alarm, where we have more than 35 cases over 7 days, where there's persons, people in critical care, hospitalizations that start to go a little bit higher, our RT number peaking over a certain amount. So there are things which are published, which have been shared, which we report on a daily basis. And those are the things of which we have to consider. There is no question that we have a significant amount of active cases right now. I don't have the records going back. I haven't actually, looked at those recently. I'm not going to say that this is the highest number of active cases of which we've had on the island reported at once. What I can say is that I can assure you that prior to shelter in place, we had a lot more active cases on the island. We just didn't know where they were.
Mm-hmm.
Now we have a significant amount of testing. I cannot stress enough the amazing work that was done by the Ministry of Health teams and our testing teams to do the amount of testing which has been accomplished since last week when we had outbreaks. I mean, to say that we've tested 10% of the population in that stretch of time is absolutely amazing, and we have certainly done so. So I need to, we have the capacity to deal with this. We have the technology, and that's the reason why we're not considering those moves at this time, but things can change quickly. As I said, it takes one infected person to go to a crowded place. That could be a gym, that could be a bar. These, and people ask you, why do I pick on these places? These are places where there is the allowance under things to not wear masks. You cannot eat, for instance, while wearing a mask. And so if you're engaged in those things, or drink, if you're engaged in those things, if you're in an enclosed space, then this will cause a problem. And it'll affect outbreak that's out of control. And that's the reason why we are urging persons to make sure they exercise increased vigilance in regards to the fines now for the observance of the mask mandate. So we're clear, the mask mandate was always in effect. This was stated in the public health emergency orders that all persons were required to maintain appropriate physical distancing. And so we're going to make sure that we put that in place. Is very important now. Even small things about, smiling, take a picture, you want to take your mask off so everyone can see it. No, we just have to be incredibly vigilant at all times. And this is something that's important.
Okay, thank you for that. Next question to Minister Wilson. It actually comes from a community member. Over 200 people have recovered from COVID-19. Have any of these persons been, checked on a regular basis, or asked to, go to the doctor on a regular basis to monitor any effects or damages the coronavirus may have had to their bodies because this strain of virus is new?
Many of those persons are already under the doctor's care. We received the report because under law, there is a requirement to report that to the epidemiology and surveillance unit. So the majority of persons that are have been tested positive for COVID are under doctor's care. So they're obviously following their doctor's advice with respect to any conditions that may resonate weeks after they're deemed to be no longer transmittable after, I think, day 28 or whatever. So the majority of them already have doctors or under their own personal doctor's care. So we wouldn't necessarily know those details because we're no longer tracking and monitoring them after they the level after the 28 days. We keep the records of them, of course, but once they're deemed recovered, then there's no follow-up from public health. Their doctors are the ones that are obviously taking care of their patients.
Okay, thank you for that. And my next question would also go to you, Minister, from a community member. When people are planning to travel to Bermuda, our guidelines are clearly stated on gov.bm about what is needed to be accepted into Bermuda with a pre-departure test. When persons plan to leave Bermuda and need a pre-departure test for their next country to travel, a community member would like to know, why doesn't our test results that are emailed from the government have the same requirements Bermuda requests? Specifically, there's no name or information of the person, only an ID number.
Okay. I think I understand that. First of all, I want to make sure the public recognize that a test in Bermuda does not count as your return test. So if you take a test at MDL or any of the other places that offer the testing here, you cannot use that to return to Bermuda. So that's the first thing. Secondly, as it stands now, the test results that you receive does have a code number. It doesn't necessarily have your name. However, if you need that for whatever reason, maybe your employer, whatever the personal circumstances are, if you call the COVID hotline, then they can make sure that the test result that is received does have your personal identification on it.
Okay, so in order to get personal identification, they'd have to start over. So when people are leaving the island and they need a pre-departure test for the next country, so they get the test here in Bermuda, get the results back to give to the next country. If that next country needs to know their names and everything, they will contact our department.
Yes. And then the result that they receive, instead of it having a number, would have the person's name and date of birth.
Thank you. And my sixth question for the night is, opposition leader on any of the changes? And if yes, what was their responses?
I have not yet communicated with the opposition leader on any of the changes. I do keep the opposition leader informed, as I did the former leader of the opposition on these matters. As I communicated earlier today, though that we came to some decisions in the cabinet earlier today. Prior to announcing those, I wanted to make sure that we consult with our parliamentary colleagues first. That would be the members of the Progressive Labor Party and also the members of the opposition. So that consultation exercise will take place by the Minister of Health over the next few days prior to her announcement on the floor of the House, the virtual House on Friday morning. And just a note, a very keen listener sent me a message. Though we have 39 active cases, the highest number of active cases we had at any one time back at the height of the pandemic was 61 cases.
Okay. Wow. Thank you. And just a quick follow-up to that. Sorry. For my last question, I'm sorry, is Chevelle
You
Dylan
sure you didn't have
Burgess.
6 already?
This will be 7.
You
Not
sure
gonna lie.
about that?
Chevelle Dylan Burgess, I just want to know because we haven't had any updates here. I know that the commissioner usually would have the updates for us, but he hasn't been there. Is there any update on her at all that government may have even received?
There's none that I can provide for you, but you can pose that question to the commissioner of police.
Okay, thank you
And
very
I
much.
will undertake to ask the governor when I meet with him tomorrow.
Thank you.
No problem. Trevor, next time we need to give you 7, right?
Good evening, Bermuda Broadcasting, Don Burgess. And the minister will be happy to know no super technical questions tonight. Just to follow up on the mask mandate, just so that nobody wants to get a $500 fine, can you list some of the places that people are required to wear that mask? So like if they're walking at Reed Street during a weekday that's out in public, are they required to wear a mask in some of the other places as well?
The regulations speak to wearing a mask in public. So if you're walking on Reed Street and you are in public, then you're required to wear a mask. Obviously, many of the grocery stores, retail stores, and the like have already implemented a policy on their own with respect to entering their facilities. So it's any public place that you are entering or walking into or walking in public, you must wear a mask.
Okay. So, and
Law is very specific, because it's very important that we make sure that I don't want there to be this confusion. The fact is that the law states that all persons are obliged to maintain physical distancing. And if they are unable to wear physical distancing, that means keeping 6 feet away, then they are required to wear a mask. So we're clear, if you're out on the beach and you're far away from anyone, you're by yourself, that would not be the case and instance. But as said, when there's the cases and places where you aren't able to maintain physical distance, in the cases where you will be in close proximity, the law since the public was declared. It is now enforceable by said fund.
okay. And just as a clarification, because I know we have a lot of very clever lawyers in Bermuda. So the legislation does say properly wear a mask? Because I mean, if somebody's doing like under the nose, they're wearing a mask.
And I see what you're saying. However, it does speak to under the guidance, and the regulations refer to the guidance. It may include guidance requiring, et cetera, and the guidance speaks to the proper way of wearing a mask.
Okay, great.
Absolutely.
Thank you. Mr. Premier, overseas students will be returning home for Christmas shortly to enjoy time with their families. If they have some difficulty obtaining a pretest and they have to quarantine on arrival, what sort of things would you encourage them in this period leading up to Christmas?
I'm going to let the Minister of Health
Okay.
handle that on the quarantine side, as she is the expert.
I wouldn't say the expert. The expert was here last night, actually, and he failed to ask many questions, but that's a different story. No, seriously, Don. Well, first of all, remember, returning residents are not required to have a pretest upon arrival. It is strongly encouraged because that would certainly limit the time in which they would have the mobile quarantine, so to speak, because then they would be able to test on arrival and they wouldn't have to wear the 8-day bracelet tracking monitor. However, it is important to reiterate the public health guidance. Approximately, some studies have said almost up to 70% of the transmitting COVID can be avoided simply by wearing a mask. So if we continue, for example, if we know that there are going to be cases that are going to come in from America, we know that because it's so prevalent there. And even though we're doing everything we can here to try to restrict that, there are going to be cases that will arrive. However, we can best avoid transmission from that particular case by wearing our masks, physically distancing, hand hygiene, et cetera, et cetera. So we all have it within our power and our control to minimize the infection and to minimize our risk. So for students in particular that are returning, I would encourage them and implore them to recognize that to exercise the precautions throughout their time whilst they're here in Bermuda while they're home, but particularly until they receive their 14-day negative test, to avoid going around their grandparents. I know it's hard because they haven't seen them perhaps for the whole term, but just recognize that your grandparents are probably frail and not all grandparents. I'm just saying they probably have some vulnerabilities that exist because by virtue of their age. Don't necessarily go around babies, and we've spoken about that as well. And don't fraternize with your friends that have been here all this time. Wait until your day 14 test is negative. Continue to apply the public health guidelines. But, many children are going to be home for at least a month. And I know 14 days might seem like a long time, but the reality is it's going to keep you safe as well as your loved ones and your neighbors. And I think that's what's critically important.
Okay, thank you. Mr. Premier, 2 weeks ago, you stated that Bermuda was about to sign a deal for testing with a well-known U.S. pharmacy. What's the status on that?
Minister?
It's actually not a pharmacy. It's a place that everybody and their brother has probably frequented at least once or twice in their lifetime. We are almost finalizing that, and we will certainly be able to be in a position in the not too distant future to be able to reveal that and to roll it out. But we are in the final stages of the negotiation, and you all will be the first to know when we reveal that.
Okay, thank you.
Mhm.
Madam Health Minister, last night we had a brief discussion after the press conference
While the camera was rolling.
about
Oh, this is the hot mic.
Yes.
I saw some tweets about that. I was like, what's going on with the hot
But
mic?
you knew it was in love, right? We all
Yes,
laughed.
about why we are not saying how many people are in each cluster.
Yeah.
Wouldn't it be a strong cautionary message for the public if, for example, they knew that one person caused at least 13 other people to become affected?
I think the cautionary measure would be message to the public. The fact is that you yourself could be asymptomatic. You could not be wearing your mask. You could be ill and continue to work. And we've all been saying that. I don't think we say that enough. If you're feeling sick, stay home. But the cautionary measure is message, is that we have control of this, and you don't want to be the person that is asymptomatic, but a positive case, goes around your work colleagues, fraternizes with bubble after bubble after bubble after bubble, and not wearing your mask, not practicing physical distancing. And then you're the one, all of your colleagues are then forced to quarantine. That some of them, that might mean that they have some type of economic prejudice because they may not be able to earn money because if they're not working, they can't get paid. So that creates an economic hardship for your colleagues. They may have children that are also then required to quarantine because of the circumstances. So it's a knock-on ripple effect. So I think the most important messaging for members of the public is you don't want to be that one. And you can avoid that by doing applying the public health mitigants that we've spoken about for 11 months.
Thank you. And my last question for tonight. Oh, my iPad has just gone blank, but Mr. Premier.
I will
right,
tell
there
you
you
a
go.
funny story, Don. That actually happened to me on election night where I had this fancy tablet and I had my whole speech. And all of a sudden, in the middle of it, it just went dead and I didn't know how to fix it. Thankfully, there was someone around to turn it on. I hope my stalling has given you the opportunity to turn yours on, Don. There you are.
Well, it's come back now. It's popped up. Mr. Premier, we understand that you had dinner with Michael Bloomberg at the Lauren. Was there any discussions about how he can help the island in the pandemic? And if so, is there anything that you can share?
I can assure you I did not have dinner with Michael Bloomberg at the
Okay.
Lauren.
Okay.
but I'm very happy that you are fully up to date on all of my supposed whereabouts.
Okay. Thank you very much.
Thank you. Thank you very much. Members of the media, I thank you very much for your questions. I leave everyone with two things. Number one, a thank you to all of our healthcare workers, to all of our testing teams, to all of our doctors in the community who are doing their work, to all of the staff, the Department of Health, the people who have been working day in and day out to make sure our country remains safe. I thank all of you who have done what is necessary to ensure that we are abiding by the rules and taking care of our community. We do have this minor issue, and I'm confident if we have the collective work and energy that we've had previously, that we will be fine and we will get through this. So I want to thank everyone very much for their efforts and look forward to speaking to you next week from this place. Please feel free to tune into the House of Assembly on Friday morning, where the Minister of Health will be giving the latest update to the House of Assembly on the changes to regulations to ensure that we can continue to protect our country and to keep it safe. Everyone, thank you, Bermuda, and good